A lot of people go on GLP-1 medications without anyone really talking to them about what might happen when they stop. They're often so excited about starting the medication that they don't think much beyond that. But it's really important because stopping is not just a medication change, it's a whole life event with physical symptoms, appetite changes, and sometimes emotional ups and downs too. So if you're thinking about coming off, or you may need to at some point, this is something you should understand before you get there. I'm Dr. Vivian Low, board certified in internal medicine and obesity medicine with over 20 years of treating obesity. I'm also the author of a book on the GLP-1 system. And here I break down the science, the real life challenges, and the practical questions people have about GLP-1 medications. Let's go. I think this is the most common question I have from patients. What happens when I stop the drug, Dr. Low? So let's recap from the previous video, real life results. Okay, 1 year after stopping the medication, users are typically going to regain about two-thirds of the total weight that they have lost, and they're going to probably be back to their baseline weight, the weight they started at, within 1.5 to 2 years. Okay, so it's pretty fast and you're gaining about a pound per month. And that can be terrifying for most people. Now, again, this is one of the drug studies. I just wanted to put it up here so you can see it. So 68 weeks on the drug, you have about 15% weight loss. And then in the study, they stopped the drugs and then they followed the participants for a year and they regained about two-thirds of the lost weight despite not going back to baseline behavior. So it wasn't like they just kind of went crazy and went out and started eating poorly and just, being very sedentary. They were trying to keep their new lifestyle behaviors, but they were still regaining the weight, and also then their health risk started to go back to baseline as the weight came up. So in the beginning, with the weight loss, it's a miracle weight loss. We are so much healthier, but at 120 weeks out, there's a large rebound. There's partial loss of benefit in a body that has clearly not reset. One of the reasons for this is the body composition, which I touched on in the last video. So when you're losing weight, and this is from anything, from surgery, from just diet and exercise, and on these drugs, when you're losing weight, you're losing both fat and muscle at the same time. Okay, you're losing both. Now, with the GLP-1 medications, you lose quite a lot of weight. And so proportionally, you're going to lose more fat and muscle, right? Just than if someone wasn't on the drug and was just trying to lose the weight by dieting alone. So because you have more weight loss, then you're going to lose more fat and you also lose more muscle. One thing I want to point out, because a lot of patients say this to me, oh, look, Dr. Low, I have more muscles now because I can see them and then they flex and they show me their muscles. But I want to point out that just because you can see your muscles now doesn't mean you have enough muscle. It's just that you've lost the overlying layer of fat. And so now visually you can see the muscle and maybe there's more definition. That doesn't mean you have enough muscle. That doesn't mean you put on muscle. It's just more visible because we removed the layer of fat that was on it. So you have to keep in mind when you're losing weight, you're losing both fat and muscle. And sadly, when we gain or regain the weight, we're gaining mostly fat. Okay? And sometimes people ask me, why is it so unfair? Why is it happening like that? Well, one way you can think about it is for regaining fat, it's like going to the supermarket, buying your groceries, coming home and stuffing it in the refrigerator. Okay? So it's very quick. Just go shop, bring it home, stick it in the fridge, right? For muscle, it's very different. To grow muscle, it's like farming. You have to plant the seeds, right? Before that, you have to prepare the soil. You have to plant the seeds. You have to water it, right? There have to be correct conditions for it. You have to make sure there are not, too many pests around. The soil quality is good. Maybe you have to fertilize. It takes months sometimes, depending on the crop, right? So growing fat is easy because it's going to the store, buying the groceries, and sticking them in the fridge. But if you want to fill the fridge with what you grow, it's going to take a much longer time. It's going to be more variable depending on different conditions, right? So, for example, if you're not eating enough protein, if you're not doing sufficient mechanical load in your resistance training, then you're not really going to grow anything, okay, for your muscle. So it's much easier, much faster. So there's a time component here. And as a result, when you regain the weight, most of it is going to be fat. Now, weight loss, I want you to remember this. Weight loss isn't something that people talk about yo-yo dieting and then they gain weight, lose weight, gain weight, lose weight, right? But what you have to remember is that you don't, when you lose weight and then you regain, you don't do it in a way that is perfectly reversible. So one way to think about this is jumping on a trampoline. When you do that, boing, 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 the trampoline surface is going to stay the same, right? When you land on it, yes, it sinks down, but once you're off it, you're in the air, or you get off the trampoline completely, then it's just going to be the same as before, like nothing ever happened. That's not the case if you jump on sand. Because when you jump on sand, right, you're going to distort the surface of the sand. You're going to leave your mark, your imprint, right? And your footprint will be there. And the sand doesn't bounce back up. So weight loss changes your body in an irreversible way. It's more like jumping in sand, and it's not like jumping on the trampoline. And that's because when you lose weight, we change the immune tone in the body. We change our metabolism in ways that we really don't even fully understand today. So there's still a lot more research to be done on this. But you have to remember that it's not perfectly reversible, and weight loss is going to change your body in an irreversible way. Going back to the drug trials, and I brought this up in the last video, remember that all of those trials involved a lot of lifestyle modification. Everyone needed lifestyle modification. So it wasn't just the medications alone. And they had, excuse me, they had intensive coaching, a lot of guidance, a lot of supervision from their medical providers. So if you're thinking about coming off, right, or you don't know how you could come off, or you're already struggling, right, especially if you're trying to self-manage this, the number one rule is you need to make sure you get a doctor, a licensed healthcare provider who knows what they're doing to supervise you and to help you with this, help you with decreasing the doses and weaning you off. In some instances, you may need to use other weight loss medications as you're weaning to try to kind of decrease the the weight regain effect. Okay, so there's a lot of dose titration that needs to be done. You need intensive coaching, so you can't just wing it. A lot of times I see people try to wing it, and what happens is when they get off or they're trying to get off the medications, because they're so worried about weight regain, the first thing they're going to do is, guess what? They're going to make sure that they don't eat. So they do their best to restrict. I'm not going to eat. I'm not going to eat. I'm not going to eat. And so they put themselves through this phase where as their appetite comes back and maybe some of the hunger pangs come back and some of the cravings come back, they're forcing themselves not to eat. And there's this fight going on. And it's a very, very emotionally, sort of difficult period for many people. And a lot of times people can feel so demoralized when they're going through that, right? So the important thing that I want you to remember is that unfortunately, when you go off the medication, you have to expect some weight regain. To mitigate that and to minimize the weight regain before you even try to go off, you should have the behavior locked in, and you should have your meal plan locked in, and you should have your medical supervision locked in, because you're going to need your doctor, right? If you want to do this in a safe way, if you want to do this in a viable way, you're definitely going to need the help of your doctor. I can't say enough that you should not be winging this and trying to do this on your own. Now, if you want more guidance, I have a guide and workbook that I created, and it's for people who are trying to get better results on the medication, or they're thinking about coming off and they need to lock in the lifestyle modifications and really get strong structure before they do so. Included with the workbook are live Q&A sessions with me in case people have questions from the workbook or from my videos. And if you're interested in that, just click the link in the description, and I will see you in the next video.